Melinda is a 27-year-old female who presents today with complaints of migraine headaches. She states she has had headaches since the age of 12. They got better for a time, but now are worse again. She has the headaches every 2 to 3 weeks, with each headache lasting 2 to 4 days. She states that the headaches started to get worse after the birth of her second child and are more frequent and more severe now. She also states that they have not been this bad since she was 15 or 16. She reports that she often vomits with her headaches and that the pain is a throbbing pain. She also reports going to the emergency room 3 times in the past 6 months to get a shot for the pain. She denies a headache at this time, but reports the pain is usually on the right side in the temporal and parietal regions, although she does have occasional left-sided pain. Melinda is married with 2 young children, ages 18 months and 5 years. She works part-time on the weekends as a cashier at the local CVS, during which time the children are watched by their father. Their father is a truck driver who is often on the road 2 to 3 nights per week. She denies fatigue when not having a headache other than taking care of the children, but states that everyone is tired when they have 2 little children, aren't they? On exam, her vital signs are weight 145 pounds, height 5 foot 3 inches, temperatures 98.2, pulse 88, respirations 20, blood pressure 132 over 86. She is Perla. TMs are unremarkable, nares benign, pharynx benign, with no lymphadenopathy, or no thyroid swelling. Lungs are clear to auscultation. Heart is regular rate and rhythm, without murmur, rub, or gallop. Her abdomen is soft and non-tender, with positive bowel sounds in all 4 quadrants. She denies nausea, vomiting, diarrhea, constipation, or heartburn. She also denies dizziness, weakness, double vision, and blurry vision. She denies weight loss or gain. She denies depression or anxiety, and she has no peripheral edema. Her neurological exam is negative. At the time of the exam, she brought the children with her and stops talking frequently to correct the 18-month-old, who is freely exploring the room and screams each time the mother removes her from looking in a drawer or playing with an electrical cord. Melinda's differential diagnoses would include chronic cluster headaches, tension headache, migraine, and analgesic rebound headaches. The most likely diagnosis would be migraine, which is highly likely due to the patient reports of headache pain, but she also denies dizziness, weakness, and vision changes at this time. She reports vomiting, throbbing pain, and pain on the right side in the temporal and parietal regions when she does have these headaches. She also states headaches last 2 to 4 days at a time, and she has a history of migraine headaches. Another diagnosis would be tension headache. This is likely due to her recurrent headaches lasting 2 to 4 days at a time, though she reports that she often vomits with her headaches, and this is not typical with tension headaches. Then there's cluster headaches, which is likely due to the location of the pain being unilateral and temporal, but less likely due to the duration of headaches and lack of accompanying symptoms. And lastly would be analgesic rebound headache, which is likely due to receiving medication shots for her pain 3 times in the past 6 months, but less likely due to her headaches and her migraine history. So I believe she is suffering from migraine headaches. And at this time, there is no additional workup needed due to the normal exam and the patient's history of migraine headaches. Medication, relaxation, or neurology consult may be needed.